or you might want to know about the B-TASE. So question 1, what is the key advantage of B-TASE? A, simpler and faster procedure. B, more uniform lipidal accumulation in the tumor. C, lower cost and easier access. And D, allows treatments without angiography. A, please raise your hand. B, C, D. Okay, great. You have learned a lot from Dr. Wu. Yes, the answer is B, just like B-TASE. Okay, so about the B-TASE, I think you have to know that the balloon intervention may benefits that presence of the distal flow and occlude the vessel. Then the flow will get redistribution. That's why we have more accumulation of lipidol. Then the access to the microcirculation is better. So the stable and the controllable prevention of proximal reflux and extrahepatic dissemination. That's the idea of B-TASE. Then move on to question 2. In which clinical situation does B-TASE show the greatest benefit? A, small HCC suitable for ablation. B, large or difficult HCC with multiple feeders. C, diffuse metastatic disease. And D is the patient with complete portal vein thrombosis. A, B, good. C, D. Okay, you get a lot from Dr. Wu. Yeah. So Dr. Wu has already tells us that for large HCC lesion, it is quite crucial for us to getting better response because it's limited uptake if we have a large HCC. So the embolic dispersion and in undesirable burden to the healthy tissue is how we really focused on. So the larger lesion that might current therapy not have a good outcome. That's why we can have to use B-TASE to such case. So this is a case of a 83-year female. So the patient had 2 HCC around 6 centimeters. So let's see if we inflated the balloon and we inject the lipidol. So you can see the lipidol that really fit into the tumor. Then the patient had the chance to get operation. So the tumor got necrosis 80% and 50% for each tumor. Another case, a 58-year-old female. The HCC is up to 13 centimeters. It's quite large. And for me, I think it's quite a little bit infiltrative. So for this kind of case, yes, I might put my occlusive at the proximal site, maybe only the proper hepatic artery, because there will be multiple feeders for this kind of tumor. Yes, then we inflated the balloon and we injected the lipidol. So that you can see that you can filling in most of the lipidol into the tumor. And the post-embolization image, you can see almost total occluded of the tumor. So the patient also get the chance to get operation. So B-TASE in preoperative use that we have known that 70% of patients can achieve the pathological complete necrosis by using B-TASE. And it can be a technique for bridging therapy before surgery. There are some updated clinical outcome studies in B-TASE. The efficacy in treating HCC that European multicenter study tells us that complete response rate at 6 months is around 59%, and median overall survival is around 50 months. And the propensity score matching study shows that B-TASE versus C-TASE. The initial complete response rate of B-TASE is 94%, quite good outcome. And then the subsegmental B-TASE study, that CR rate is also around 97% at the first follow-up. So it's the oily subsegmentectomy prevents local recurrence. Then let's move on to the last question. what is the typical balloon deflation time during the B-test? I think Dr. Wu has already given the answer. A, less than 10 seconds. B, around 30 seconds. C, 2 to 3 minutes. And 4 is continuously inflation throughout the whole procedure. A, B, C, D. Yes, it's B also, because of the B taste. Yes, so balloon deflation is around half a minute. So don't be rushed. You have to like see the balloon deflated under the fluoroscopy, and you have to wait, around 30 seconds. So you have to be patient. Then after all the contrast mediums were gone, then you can remove your microcatheter. Yes, you have to wait, okay? So in conclusion, HCC for large lesion treatment is very challenging. So B-TACE can have a flow redistributions and get the access to microvascular circulation. It can create tumor or a radiological response. And it also improves the clinical outcome. And for the balloon, it can full protection against the reflux. Thank you.